Hi, my name is Jacob, and I'm a student in the Doctorate of Physical Therapy program at the University of Kentucky. Today, I'm going to provide some information to both patients and providers on central sensitization and how pain neuroscience education and physical therapy can be used to treat chronic pain. Central sensitization is chronic pain that arises from a dominance of neurophysiological dysfunction within the central nervous system. It's a connection between the brain, body, and environment. A painful experience and all of the contributing factors, which include fear and anxiety, family concerns, job or financial stress, failed treatments, and past experiences with substance abuse, PTSD, or other trauma, all combine to become the lion in the room, which is central sensitization. Before this experience, your alarm system allowed you to perform all the activities you wanted without any issues. With a lion in the room, your stress hormones rise, which increases your heart rate, your breathing, and affects a variety of other bodily functions. Over time, this resets your body's alarm system, which limits your ability to perform your normal activities in daily life. Patients who experience central sensitization experience a variety of symptoms, but these are some of the most common. A patient will experience hypersensitivity to light, touch, noise, pressure, and temperature. Their pain is often disproportionate to the nature or the extent of the injury and often presents with an illogical, widespread pain pattern that doesn't match the typical injury. Patients may also experience night pain and have disturbed sleep schedules. There are also psychological factors. Patients will avoid movement due to the fear of pain, they'll feel their pain at a higher level than normal, and have poor self efficacy. In other words, they won't have the belief and confidence in themselves to overcome their pain. Central sensitization has been shown to be common in patients with these medical conditions, such as chronic low back pain, arthritis, fibromyalgia, and irritable bowel syndrome, as well as other musculoskeletal conditions and even following surgeries. So you may be asking yourself, what can physical therapy do to help? Physical therapists are often thought of as those who rehabilitate and get people moving after an injury or surgery, but in reality, physical therapists possess the knowledge and the skills in a wide variety of topics to influence many aspects of life besides the musculoskeletal system. Physical therapists will perform a thorough examination, looking into the patient's history, including other medical conditions that may affect their patient's care, and also the psychological factors that were covered earlier that may influence the plan of care. They will look into the patient's pain, looking at the details, such as the type of pain, where it hurts, how long it lasts, what makes it worse, and what makes it better. PTs also utilize screening tools such as the Central Sensitization Inventory to assess a patient's level of sensitization, allowing them to track the progress of their patients over the course of treatment. One strategy physical therapists can use is pain neuroscience education. Pain neuroscience education is all about getting the patient to understand where pain comes from, how the brain is in control, how it affects the body, and what you can do to take control of it. Pain stories were developed to put pain neuroscience in simpler terms that helps patients lessen their pain, regain function, and take back control of their lives. Some pain stories have been incorporated throughout this presentation, such as central sensitization as the lion in the room and your body's alarm system. PTs even have tools to help evaluate their patient's understanding as they progress through treatment. They can use the revised Neurophysiology of Pain Questionnaire, which is a short 12-item questionnaire to track a patient's conceptualization of the biological mechanisms behind their pain. Physical therapists and their patients are partners in addressing pain, with a goal of building self-efficacy in patients so they can overcome their pain. In other terms, your PT wants to work with you to build the confidence to take control over behavior, motivation, and ultimately the pain. PTs can utilize hands-on manual therapy techniques to address musculoskeletal impairments and develop exercise programs that help to improve appetite, heart health, brain function, the nervous system, energy levels, digestion, mood, and memory. These exercise programs are based on graded exposure, meaning that you start small and slowly build up to get back to the things that you want to do. PTs can also provide resources, guidance, or referrals to other professionals in a variety of topics, such as nutrition, mindfulness to help manage stress, sleep hygiene, management of medications, counseling, and goal setting. Many of these topics are addressed in further detail and other great resources in the toolkit, so I would encourage you to check those out if you're interested in more information on these specific topics. Research shows that 1 out of every 2 patients utilizing Pain Neuroscience Education Plus through physical therapy can improve their daily function, and 1 out of every 3 can improve their pain, making physical therapy a great choice for those suffering from chronic pain and central sensitization. So, here I've included some resources for both clinicians and patients if you're interested in learning more about pain, central sensitization, and pain neuroscience education. If you think that you're experiencing central sensitization and need to seek treatment, reach out to your primary care physician or physical therapist to discuss your treatment options. Remember, you're not alone and you can take back control over your pain.